Late Night Health continues. We're going to talk about orthopedic stuff. We're going to talk about them bones, those crazy, lazy bones. We go to Boulder, Colorado. I made a mistake, not Colorado Springs, to speak with Dr. Joanne Halbrecht. And she's been talking pretty much about alternatives to surgery. Now, you got to understand, Dr. Halbrecht makes her living cutting. No cutting, no money. So I congratulate you on that. And Dr. Halbrecht, welcome to Late Night Health.
Thank you.
Let's, I don't know a lot about orthopedic surgery. What I know is Callie from Grey's Anatomy, okay? And, she rebuilds people and makes them bigger, stronger, faster. She gives them new legs when they don't have anything. And, it's a pretty amazing thing. And I think they use a lot of the state-of-the-art technology within the stories for Grey's Anatomy. I'm just assuming. How did you get into orthopedic surgery? And I have to back up. I'm sorry. You were also an engineer.
Yes.
You spent 5 years as an engineer before you went back to med school.
So actually, I graduated from college, had an undergraduate degree in engineering. I did not work as an engineer.
Oh, okay.
Yeah. So after that, I worked for a year in the orthotics and prosthetics business, and then I started medical school. But what got me into orthopedics was an interest in biology and math and science. And I originally wanted to be a bioengineer. And I went to a lab. My brother attended University of Pennsylvania. And I went to one of the labs to meet with a couple of the women who were PhD bioengineering students, and spent some time with them, and it was kind of lonely in the lab. And I really loved the interaction with people. And so I had volunteered in a hospital in New Jersey to just look at different parts of medicine to see what might interest me. And the nurses said to me, we want to really discourage you from going into surgery. You should do something like pathology so you don't have to deal with people.
Oops.
And they brought me to a room where the doctor was doing a joint replacement. And I saw them bring the implant out of the autoclave. Back then they used to sterilize them. Now they come already sterile packaged, and they brought it into the room for them to implant. And I said, that's what I want to do, because that's the blend of engineering and biology that I was looking for, and including the patient interaction. So I went to medical school to be an orthopedic surgeon. When
somebody has a hip replacement or breaks their hip, and they're at a certain age, and I'm not sure what that age is, say 75 and up, why is it the beginning of the end, or it seems to be?
It is devastating, and so we know that when someone who is in their 70s, getting on in years, that when they have a hip fracture, it changes their level of independence. So that if they were independent, now they have to be in assisted living. If they were in assisted living, they go to a nursing home, and many times if they're in a nursing home, that leads to their demise. So it is so, and one of the things that we've found that can prevent us from having hip fracture is good nutrition in our teens and 20s, because it relates to calcium in our bodies and the development of osteoporosis when we get older. So,
do you believe in supplementation? I'm for because the body doesn't absorb enough calcium or vitamin D, magnesium from the food that we eat today.
Yes, especially when we get older too.
Right.
But nutrition is so. I see people now going away from dairy and nutrition for the young girls, and it's so important that they have enough calcium in their diet, and so, I work with a nutritionist, and we talk about how dairy can be very good because it's a good source of calcium, and so we know how important that is for them to get that early in life, and then later on in life when people do have problems with bone density, then we can take some medications that will help increase our bone density.
You are traversing the country, I believe, and presenting different options rather than surgery.
Yeah.
There have been some surgeries, and I'm going to ask you to tell me what those are, that 10 years ago, maybe 15 years ago, were considered the standard.
Yeah.
And they've been proven to be ineffective.
Well, they can be effective, but the problem is that we are removing normal anatomy to relieve pain instead of using other modalities which are conservative and don't involve the risk of a surgical procedure, as well as the possible complications of that, damage to nerves and blood vessels, blood clots, infections, etc.
In other words, what's happening if like a rotator cuff, you go.
So the condition in particular. So the thing is, there's a lot of things that happen in the body where you have a tear and it needs to be fixed.
Right.
But there are other problems that really relate to biomechanics and the position of our body and what muscles are strong and which muscles are weak and how the body reacts to it. So what had been termed for many years impingement syndrome was really popularized in the 70s, the treatment for which was physical therapy and steroid injections, and then if the person failed that, then they underwent surgery. And just to define impingement syndrome is basically decreased space for the bursa in the shoulder. Now, the bursa is like a deflated balloon with some oil in it, so It's a little fluid-filled sac, and they're all over our bodies in areas where there's potential for friction. And the thing about the bursa as well is that it's loaded with nerve fibers. So if things aren't appropriately aligned and we get some pressure on the bursa, it begins to swell and we start having pain. And so this impingement syndrome is in the shoulder, in the bursa that is right at the top of the shoulder underneath the bone. That bone is called the acromion, so we would call it a subacromial bursitis.
I was going to ask if this was bursitis.
Yes.
Isn't bursitis a form of arthritis?
No.
It's different.
So arthritis is an inflammation in a joint, whereas bursitis is inflammation in a bursa.
Okay.
So we have the bursa. You can have a bursitis in your hip. You can have them in your knee. And what we're talking about with impingement syndrome is in the shoulder. So what we had thought many years ago, when you look at papers from back then, how they examined the patients and how they treated them, really didn't look at the whole shoulder girdle. And really, when I was in my training, when we would study the shoulder, we look at the rotator cuff and concentrate on the little muscles around the shoulder and not really look at the muscles that attach the shoulder blade to the spine and what we call periscapular muscles, because that shoulder blade is called the scapula. And the periscapular muscles are extremely important. Back, if you look at some papers even from the 90s where they describe impingement syndrome, they talk about the bone, that acromion that I was saying that is right above the bursa, having a hook or a spur on it, and how patients with this type of acromion or a hooked or spurred acromion had a more likelihood of developing bursitis, and then when you do surgery, you burr that off. So this paper that I was talking about that reviewed impingement syndrome in the mid-90s also cited a study that was done on some 400 cadavers, and they looked at the shape of that bone, that acromion, and found that the shape of it doesn't change with age. So the thing is if you've had that same acromion your whole life, now why is it all of a sudden a problem, and why does it need to be burred off?
And by burred off, you mean sanded down?
Yeah, so they actually go in, like in the dentist, you know, how they have a little burr in there?
Right.
You go in with a burr and you burr the acromion so that it's flat and no longer has a curve or a hook on it.
And today they don't. What do you do for that same
today
condition?
it's a very common surgical procedure. However, in most people who have impingement syndrome and don't have a tear, rotator cuff or whatever else, they don't have a tear in the shoulder, I found that the best way to treat those people is conservatively with physical therapy and the use of something called the posture shirt, which I found to be just revolutionary in my practice of medicine and treating shoulders.
The posture shirt will work for shoulders as well as the back?
Yes.
Wow. You know, we have a doctor, Dr. Rich Sagel, who runs Needy Meds in the Boston suburbs, and it's a nationwide nonprofit. And he told me an interesting story. He said that if a back goes out, in quote, and that's how Late Night Health started, because my back went out and I was prescribed physical therapy, and the insurance company denied it after 3 visits. The prescription, thank you, Blue Cross, Anthem Blue Cross, we salute you. They denied the claim, and they never gave me a reason why. I went to my chiropractor who gave me physiotherapy, which is identical, it's the same thing. And I was, it took a while. My prescription for physical therapy was 3 months, and I think in 6 weeks I got bored and I stopped, but I was fine. My point is that Rich Sagel has said that if your back goes out, you have a problem. Most backs correct themselves if you leave them alone. Would you agree with that?
So 90% of low back pain resolves spontaneously within 6 weeks.
Holy moly.
Whether you treat it or not.
Wow. All right, we're going to take some time out. We're going to come back and talk about the posture shirt. I have worn it. It is terrific because my wife says I have bad posture, but when I wear the shirt, she says I look 2 inches taller. So that's a good thing. Our guest is Dr. Joanne Halbrecht. We're talking about the posture shirt and new roads in orthopedic surgery. I'm Mark Alyn. This is Late Night Health. Join us at latenighthealth.com.
Whether it's a serious fall, fire danger, or other type of home emergency, Life Alert is there for you. The company with its slogan, "Help, I've fallen and I can't get up," protects its members. Here are some of them.
When you have a heart attack like I did and there's no one there, Life Alert was there for me.
Having a secure feeling through Life Alert is ideal.
My independence is possible because of it.
Now, Life Alert can also protect you in a fire emergency with a system that automatically notifies our monitoring center.
Thanks to Life Alert, you can live alone without ever being alone.
For a free Life Alert brochure, call 1-800-814-1092. That's 1-800-814-1092. Call now, 1-800-814-1092. For a free brochure, call 1-800-814-1092. 1-800-814-1092.
We all know healthcare has changed drastically. It's quite the puzzle to sort through your options and find a health insurance plan that's affordable and maximizes your benefits. And you're now required by law to have health insurance, or you may pay a tax penalty. So let the Health Markets Insurance Agency help you. They offer plans from over 120 different companies and can even help you obtain government subsidies. Let them do all the research for you and show you how affordable health insurance can be, a service that's at no extra cost to you. Remember, you have a deadline to get health insurance, so call right now.
800-506-0440. 800-506-0440. 800-506-0440. That's 800-506-0440.
Health Markets Insurance Agency is a DBA or assumed name of Inspire Insurance Solutions, Inc., which is a licensed insurance agency in all 50 states and D.C. Not all agents are licensed to sell all products. Service availability varies by state.
This is a referral service. Calls will be routed to an independent referral insurance agency.
Listen up, America!
Listen up, America. I'm talking to anyone with or without a pre-existing medical condition. A health insurance hotline has now been established to provide health insurance for all Americans, even uninsured Americans with pre-existing conditions. Call now for a free, no-obligation quote on affordable health plans available to you. 1-800-690-6620. I repeat, this is a hotline providing free quotes for affordable health plans. It's for anyone without health insurance, even if you have pre-existing conditions. Medical costs are the number one cause of bankruptcy and financial distress. All uninsured Americans are strongly urged to call this national health insurance hotline right away to protect yourself and your family from an unexpected variety of medical costs that could cause financial hardship. Call the health insurance hotline right now for a free quote at 1-800-690-6620. That's 1-800-690-6620. Call 1-800-690-6620.